For that, I'm saying Mr Messenger's made wild claims in the past. He's made wild claims on this occasion.
G'day, I'm Rob Messenger.
There were suggestions earlier on, particularly from Mr Messenger, who I note was a former Member of Parliament and has been somebody who's prepared to say and do a lot of things at times that are quite devoid from reality.
I've upset a lot of important people, including Queensland Premier Campbell Newman. I've also helped a lot of important people. Can I get you to state your name, please?
Yeah. Tony Hoffman.
And what position are you, Tony?
I'm the nurse unit manager of the intensive care unit, chronic care unit at Bunderberg Hospital. And if nothing's, what can you do? And that's why I guess I'm here asking you, who has nothing to do with the hospital whatsoever, to try and do something to save these patients from this man. And it sounds all very melodramatic. And, I know we had to call him up, so it's crazy. This can't be happening. But it is happening.
I believe you, I trust you. In 2005, I trusted nurse whistleblower Tony Hoffman when no one else would. And now, 7 years later, in 2012, I trust Joe Barber, Queensland's most important whistleblower ever.
Is it fair to say that there could still be a serial killer doctor working in Queensland? Yes, it is. I'm convinced, having worked on this case myself over a number of years, seeing all of the evidence and having handed that evidence over to the police and to the CMC, that there is a doctor working in Queensland who is or could be a serial killer. I've even had now a look more recently and studied cases overseas where this has happened, a case in England for a doctor named Shipman, and there's no doubt in my mind that the doctor that I've referred previously to the police and to the CMC is deliberately ending the lives of patients. I was a senior member of the medical board. I was senior administrative staff member of the medical board. The complaint was made to the medical board alleging that he'd ended the lives of a number of people. 3, I think, at that point. And there was a 4th one that was considered as well. I was the investigator initially at the board who looked at this case. And during the course of looking at it, I made recommendations that the matter be referred to police, which the board refused to do. So I had to investigate it at the board with few resources, but, did my best. Whilst the board was looking at this case, we got new information of other cases coming in. He was allowed to continue to work, and there were new cases coming in regularly saying that he was continuing to try to end the lives of other patients at the hospital where he was working.
A retired judge, Richard Chesterman, was appointed to assess Joe Barber's complaint against the doctor accused of killing a number of patients. The judge was also given a recording of a phone call I received from a doctor who rang to support Joe Barber. He said that Joe Barber was right and that murder charges should be laid against a fellow doctor who he says is a killer.
Partly, he had a motive in a peculiar sort of way, which was that he was prepared to kill people if it saved his authority from being questioned, or if it proved a point to other people he wanted to prove a point to.
Did you think that murder charges should have been laid against Dr.
Yes, I do.
After listening to that phone call and other evidence, the judge ordered Queensland Police to investigate the alleged serial killer doctor. Judge Chesterman wrote in his report to Parliament that there were serious questions.
The police investigation and what they've discovered about my mother's murder. The police have been anything but helpful. They did have a chat to me. There were no statements ever given to the police by myself or my brother. The police felt on the day that they spoke to me that really they didn't feel that there was any case that the doctor had to answer. They had looked at all of the evidence and felt that some doctors have to do things that for families are perhaps rather painful, but it's something that doctors have to do.
This is just to be held off patients, physically restrained from withdrawing treatment from patients by a doctor. Those sorts of things, as you know, just on the grapevine, would be going around that hospital.
But the fact that he also had worked there for 5 years previous, and that none of those previous records of people that he dealt with have ever been released. The hospital has refused to give over.
Joe Barber and I gave Campbell Newman and his government all the evidence about Queensland's alleged serial killer doctor and more. Campbell Newman has allowed this person to continue to work, while police differ. When questioned, Campbell Newman prefers to personally attack me.
I'm saying Mr Messenger's made wild claims in the past. He's made wild claims on this occasion.
That's the same behaviour corrupt Labor politicians used when I first helped Tony Hoffman speak out about Jayant Patel.
There were suggestions earlier on, particularly from Mr Messenger, who I note was a former Member of Parliament and has been somebody who's prepared to say and do a lot of things at times that are quite devoid from reality.
It's time to stop the personal attacks and political games. It's time to show some leadership and act to protect Queensland families from a very sick health system and some very dangerous doctors.
The general public absolutely should be protected from living or dying, depending on the whim of a doctor who might kill you if he took a dislike to something you or your relatives said.